Walking may be one of the most underrated health interventions we have, and I know that sounds almost too simple because we live in a world of expensive gym memberships, supplements, fitness trackers, biohacking protocols, and complicated workout plans. But as an internal medicine physician, if I could prescribe just one habit to almost every adult trying to improve their metabolic health, blood pressure, blood sugar, mood, and longevity, it would probably be walking. Not because walking is flashy, but because the physiology is truly powerful. And most people dramatically underestimate what happens inside the body when you walk every day. This is especially important for parents and career driven adults because honestly, many people are sitting most of the day, they're stressed, they're sleep deprived, they're eating quickly, and then wondering why their weight is just creeping up. Their labs are only getting worse, and their energy is truly disappearing. Walking will not solve everything, but it is one of the easiest ways to start reversing the direction your metabolism is going. So let's talk about daily walking and what it actually does to your body. The first thing that walking does is improves cardiovascular health. Your blood vessels are not just pipes, they are living tissues. The inner lining of your arteries is called the endothelium, and one of its jobs is to help vessels relax by producing something called nitric oxide. When you walk regularly, blood flow increases across the blood vessel wall, and that gentle shear stress helps improve endothelial function. In simpler terms, your arteries become better at relaxing, and that truly matters because stiff, poorly functioning arteries are linked to high blood pressure, heart disease, stroke, and vascular aging. There was a large meta-analysis in the European Journal of Preventive Cardiology that looked over 400,000 people and found that higher daily counts were associated with lower cardiovascular risk. And the benefit is meaningful because people normally have low step counts. And the second major benefit is blood pressure. High blood pressure is one of the most common conditions I see in internal medicine. And the reason it matters is because it silently damages the body for years. The brain, the kidneys, the heart, the blood vessels. And most people do not even feel high blood pressure until damage has already happened. And regularly walking has been shown to reduce systolic blood pressure, the top number, by roughly 3 to 4 millimeters of mercury on average. That may not sound so dramatic, but at the population level, even small blood pressure reductions translates to meaningful reductions in strokes, heart attacks, and kidney disease risk. That's why walking helps blood pressure through several mechanisms. It improves endothelial function, it reduces arterial stiffness, it improves insulin sensitivity, and it even lowers sympathetic nervous system tone. And over time, it could even reduce visceral fat. So walking is not just burning calories, it actually changes the vascular environment that your heart and arteries operate every day. And the third benefit, maybe one of the most important one of them all, that is metabolic health. Walking improves blood sugar regulation. Every time you eat, glucose enters your bloodstream. Your body then has to move that glucose into cells, and insulin helps do that. But muscle contraction itself also helps move glucose out of the bloodstream. That means after you walk after a meal, your working muscles begin pulling glucose from the blood and using it for energy. This is especially helpful for people with insulin resistance, prediabetes, type 2 diabetes, fatty liver disease, or abdominal obesity. But here's the interesting part. Timing matters as well. A study published in Diabetes Care found that 3 15-minute walks after meals improved 24-hour glucose control more than one 45-minute walk done at another time. That means that a short walk after breakfast, lunch, or even dinner may be one of the simplest ways to blunt post-meal glucose spikes. This is why I often tell patients, don't underestimate the 10-minute walk after dinner. It may look too simple to matter, but actually it matters. Physiology tells us that because repeated glucose spikes over months and years contributes to insulin resistance, vascular inflammation, fatty liver disease, and metabolic dysfunction. And the fourth benefit is kidney protection. Your kidneys are extremely sensitive to blood pressure, blood sugars, inflammation. This is why diabetes and high blood pressure are two of the leading causes of chronic kidney disease. And walking helps indirectly by improving the major drivers of kidney damage. Lower blood pressure reduces pressure inside the tiny filtering units of the kidneys. Better blood sugar control reduces glucose-related vascular injuries. Less inflammation reduces chronic kidney disease. There are studies showing that people with chronic kidney disease who walk regularly have lower rates of progression of their kidney disease compared with those with sedentary lifestyles. So now walking is not a cure for kidney disease. I'm not saying that. But if someone is trying to protect their kidneys long term, walking belongs in that conversation because kidney disease often progresses quietly. And by the time symptoms are obvious, significant function may already be lost. But the fifth benefit now is fatty liver disease. This is a huge one. Fatty liver disease is one of the common causes of liver conditions in adults. Many estimates suggest that it affects roughly 25 to 30% of adults globally. And most people who have it do not even know because fat accumulates inside liver cells. At first, there may be no symptoms, but over time, fatty liver disease progresses to inflammation, fibrosis, cirrhosis, and liver failure in some people. It also strongly is associated with insulin resistance, visceral fat accumulation, high triglyceride levels, as well as metabolic syndrome. And walking helps because it improves insulin sensitivity. It increases the body's own ability to use fat for energy. And research shows time and time again that aerobic exercise can reduce liver fat when weight loss is modest. And this is important because many people think that the only way to improve fatty liver disease is to lose a large amount of weight, but that's not true. Weight loss does help tremendously, but movement itself has the metabolic effects of the liver. So when you walk consistently, you are not just helping your legs, you are helping your liver handle fat and glucose more effectively. And the sixth benefit is joint health. A lot of people avoid walking because they think it will wear out their knees, but for most people, the opposite is true. Cartilage does not have a strong blood supply like the muscle does. It gets nutrients from joint fluid, and that fluid circulates better when the joint moves. So movement helps nourish cartilage, and walking also strengthens that muscles around the joints, especially the quads, the glutes, the calves, and the hip stabilizers. And what that means is that stronger muscles act like shock absorbers. They reduce the load directly transmitted through the joint. And studies actually show that with people with or at risk for knee osteoarthritis have found that regular walking is associated with less pain and better function over time. Now, obviously, if someone has severe pain, unstable joints, acute injury to that knee, or advanced arthritis, they should be evaluated by their physician and modified activity appropriately. But the idea that joints should simply be rested forever is really wrong. Joints need movements. And the sixth benefit is muscle preservation and mobility. Walking is not the same as resistance training. If your goal is to build significant muscle, you need a progressive strength training. Walking still matters, but as we age, we lose muscle mass and function. This is called sarcopenia, and sarcopenia is one of the biggest reasons why people fall, they become frail, they lose independence, and they struggle later in life. Walking helps maintain lower body endurance, coordination, balance, and functional capacity. It helps keep the nervous system communicating with the muscles. It helps preserve insulin sensitivity, and it makes it easier to remain physically active to keep doing other healthy behaviors. For parents in their 30s, 40s, and 50s, this matters more than people actually realize because the climb usually starts quietly. You start suddenly having less movement, a little less strength, a little more sitting, a little more weight gain. Then years later, stairs feel harder. You start having back pain that's only getting worse. Your energy drops and the body starts feeling older than it should. Walking and resistance training helps interrupt that decline. And the eighth benefit is mental health. And this one's very important. This may be one of the most noticeable benefits for many people. Walking improves mood, it reduces stress, it can reduce anxiety symptoms even, and it can improve depressive symptoms. And it gives your brain something most modern adults do not get enough of. That's low intensity movement without overstimulation. Physiologically, walking affects endorphins, endocannabinoids, cortisol, brain-derived neurotrophic factor called BDNF. BDNF is sometimes described as fertilizers for the brain. It supports neuron health, learning, memory, as well as cognitive function. And walking outdoors may be even better because you add sunlight, circadian rhythm support, and time away from screens, and that's important. For busy parents, this is powerful because a 15-minute walk may be one of the few moments in the day where your nervous system actually downshifts. It gets rest. No phone, no email, no task switching, no trying to figure out where your kids are, just movement that matters. And the ninth benefit is longevity. When you combine improvements in blood pressure, cardiovascular health, blood sugar, liver fatty disease, kidney risk, joint function, mental health, and mobility, you begin to see why walking matters. Walking is associated with a longer life. A JAMA internal medicine study of older women found that those walking 7,500 steps per day had significant lower all-cause mortality, meaning you'll live longer compared with those around 2,700 steps, which is average. And the interesting part about it is that benefits appear to level off around 7,500 steps in that study. That's important because people often think that they need 15,000 steps to 20,000 steps per day to reap benefit, and that's actually not true. The biggest benefit is often going from low activity to moderate consistent activity. Going from 2,000 steps a day to 7,000 steps a day is a massive change in your physiology. And this is really where the many people get the highest return. So the goal is not perfection, the goal is to be consistent. Now let's talk about how to actually implement this. Because knowing walking is good does not automatically make people do it. First, find your baseline. Look at your phone or watch and see your average daily steps over the last week. If you currently are walking 3,000 steps a day, which a lot of people are, do not immediately demand 10,000 steps the next day. That will fail. Instead, what I suggest is add one 10-minute walk per day. Do that for 2 weeks. Once it feels normal, add another walk. And second, anchor walking to something you already do. So, for example, after breakfast, after lunch, after dinner, when you're on your phone, talking to family, before work, for example, after dropping off the kids. Those are some examples that you could start doing to help you get in the habit of walking daily. And it's important because oftentimes the best habit is one that fits your real life. Third, use post-meal walking strategically. This means that after a meal, you're going to go for a walk. If blood sugar, insulin resistance, belly fat, or prediabetes are concerns, this 10-minute walk after meals is one of the highest returns you can build, and it's one of the best habits you can actually start implementing. You do not need to crush yourself, just walk. And fourth is aim for a realistic step range. For many adults, a good target is roughly 7,000 to around 9,000 steps per day. Some people will do more, some will do less, but try to aim for that goal. But this range is actually key because it's not too much. It is actually something that can be implemented by anybody. And fourth, walk at the right intensity. A good pace is one where you can talk, but singing would be difficult. That usually means you are walking briskly enough to get cardiovascular benefits without turning it into a punishing workout. 6, combining walking with resistance training. Walking is excellent alone, but it often is not enough to itself for optimal aging. Ideally, you want to pair it up with resistance training 2 to 4 times per week for about 20 to 30 minutes. Walking improves metabolic health and cardiovascular function, but resistance training preserves muscle and strength. That's why together they're one of the most powerful combinations for long-term health. So here's the takeaway. Walking is not just a key to burn calories. It improves blood pressure, it improves glucose control, it improves insulin sensitivity, it will improve your liver health, it will improve your joint health, and it will help regulate your mood, and most of all, it will preserve your life and make sure you're functional. And that's what's important. When it comes to walking, it's not about doing so much that you're going to quit on it. It's making it consistent, a daily habit. That the best part is that it's free. There's no supplements that's needed. All that it requires is for you to be motivated to be able to do it daily. And it doesn't require a complicated program. It doesn't require a perfect schedule. It just requires repeated movements daily for months, for years. And as an internal medicine physician, I think many people are waiting for a complex solution to problems that often start with the most basic human movement. So my suggestion is to start simple, start implementing it as soon as you can, start slow, and eventually add it to every part of your life. Walk 10 minutes after a meal, add 1,000 steps to your baseline, take your kids with you, walk with your spouse, walk while talking on the phone, and eventually this will be part of your identity. And you will start seeing significant benefits because truly it just starts with walking. Eventually this walk will allow you to now start going to the gym, will allow you to look at your diet a little bit better, and will start making you have changes that will last a lifetime.